It's now my pleasure to introduce Linda Learn. Linda is a registered social worker with a master's degree in social work from the University of Toronto. She's been providing counseling services to cancer patients and their families since arriving here at the Cancer Centre in 2001. She previously worked at community agencies and in private practice with a particular interest in women's issues. Here at the Pinsky, Linda is the team lead and coordinator for the award-winning program Out of the Shadows, Living Well After Cancer, an education series for patients completing treatment for early-stage cancer. She's also the co-investigator for the Uptake Research Project, which was a study exploring the reasons for the lack of uptake of genetic testing in high-risk families. She's the designated social worker for the breast and lung cancer disease site teams and the regional psychosocial oncology lead. She volunteers at Wellwood Resource Center here in Hamilton and is co-chair of the Life After Breast Cancer Conference Planning Committee. And then, when she has some spare time, Linda enjoys gardening, walking her dog, reading, making quilts for a local charity, and spending time with her grandchildren. Please join me in welcoming Linda.
Thank you. So I'm not going to show you any really exciting pictures, I have to admit that. But I'm going to talk about some other issues. And I'm not sure which button I'm supposed to push here. I'm sorry.
This one here?
This one here. Okay, so there we go. So what I'm talking about tonight is what is coping, strategies for coping, considerations for the future, so financial resources and community resources. And it just pains my heart so much to hear Mike's story. I hesitate to say that it's not an unusual story. We live in a wonderfully rich and privileged country, and we live in a wonderfully rich and privileged province, but we have major gaps in our social network, and we have major gaps in our funding for cancer patients. So I'm very sorry to hear your story, Mike, but thank you very much for sharing with it. It took some courage and a great deal of thought. Thank you. So what is coping? I looked up a number of different ways of talking about coping, some of which you can see here: managing, handling, striving, muddling through, surviving, hacking it, getting by, or dealing successfully with a difficult problem or situation. And those are all words that I hear daily in my office about how people are doing it. And sometimes they have the word not in front of it. But sometimes they also have the word just by itself that they are managing in some way. So, coping. It also can be looked at in terms of adapting or resilience. So adapting is to make or become suitable for a new use or a new situation. And in the Out of the Shadows program, my part of the talk is adapting to the new normal. And I have patients who say, if you say new normal one more time, I'm going to slap you. And I have been threatened many times. I've never actually suffered violence here at the Cancer Centre. But patients don't like the idea that after a diagnosis of cancer, things are new and different. And they can be new and different for you physically. They can be new and different for you emotionally or financially. In many different ways, your relationships can be new and different. But people adapt, and that means that you become used to a new situation. So the other part of coping is resilience, or springing back to the original form after being bent or stretched. And apparently surgical tools aren't very resilient if they don't spring back. They can be springy or readily recovering from shock or depression. And I'm not sure what readily actually means. I know that cancer patients can respond very quickly. I know that cancer patients may take years to respond. So when we talk about readily recovering from shock or depression, it can really range for cancer patients. The research in both breast and ovarian cancer suggests that it takes about 5 years to really recover after your treatment. And that's emotionally, not physically. So I have here two little creatures. I'm not sure if you can actually read what it says, but the polar bear is saying, "So, we beat the crowd, now what?" And the penguin is saying, adapt, baby, adapt. It talks about change. So, what do we mean when we say how to cope? Well, overall, coping is living life richly and fully, and that's all that any one of us can ask to do. We really want to live our life as richly and fully as we possibly can, no matter what's happening. So really, how do we go about doing that? Well, first of all, stop and rationally think out what is happening in your life or in your situation or in your husband, your wife, your family member's situation. Would you hear an announcement? Maybe not. So you rationally just think about what's going on in your life. First of all, what information do you already have? What information do you have about the cancer? What information do you have about yourself or your partner, your family? What information do you have about your resources? And your resources can be things like family or friends, or it can be your financial resources. What do you have available to you? What do you have available to you in terms of sick time or savings or benefits or insurance plans? So think about, what do you already know or have? What resources do you already have? The reason I include that is because many people, when they're diagnosed with cancer, feel really overwhelmed, and they really lose touch with what they already have, with their skills. Most people are survivors. Most cancer patients function quite well in life. They have relationships, they have jobs, they carry on quite well. And suddenly you're diagnosed with cancer and you have many, many decisions to make. You have a lot of information to gather, and you have a lot of things that just are really overwhelming. So you can lose touch with what you already know about yourself. So the second thing is, what do you need to know? What's the information that you need to know about your situation, about your particular cancer? How many of you, when you were diagnosed, went on the internet? And how many of you knew exactly what you were researching? Well, a couple of people. I've had people who have come in with brochures about different kinds of cancers, and I've had to say, I'm sorry, that's not the kind of cancer that you have. It's useless information. So you need to figure out what it is that you really need to know. You need to know from the doctor what your diagnosis really, truly is. You need to know from your HR department, what resources do you really have? You need to know from the government, what can you access and what can't you access. So you need to know really what you need to know. That can be really difficult, but you kind of need to narrow it down a little bit. And finally, you need to develop a self-care plan, and this is actually quite a difficult thing to do. But what I like to suggest, and this comes from the stress management research, and it also comes from a talk that I heard from Dr. Rob Rutledge several weeks ago. He was at Wellwood Resource Center, and I'm not sure any of you actually were able to catch him. We were fortunate enough to have him come in from Halifax and do a talk, and he talked about many of these points. So I feel quite secure, and I feel quite good that I'm able to present the same information. He actually presented it much better than I do, but needless to say, we'll just go on with that. So he suggests one activity in every area every day. So we look at the physical, the emotional, the spiritual, and the social. And you all recognize that those are all parts of ourselves. So we want to do one activity every day in each area. And I'll go into those in a little bit more detail. So why do we suggest that? Because you're a human being. You are not cancer. You are a human being. And that's what makes my profession a little bit different than the medical professions, is that we really take a look at the whole environment. We look at all of the individual needs of the patient. So we're looking at the psychological, physical, emotional, practical, information, spiritual, and social parts of a patient, and how cancer affects all of those different parts. And each patient is unique, and each patient will have strengths and weaknesses in each one of those areas. Some people will be very powerfully affected emotionally. Other people will be really challenged spiritually. Other people just want straight information. So every patient, every family is unique. So we want to talk about physical activity. So we have lots of different physical activities that we can participate in. And I know from my profession as a social worker that I can prescribe or recommend physical activity because the research tells us that it is healthy for us psychologically. And this is research that has been done at the University of Guelph and University at Toronto. So it's Canadian research. Physical activity can help with anxiety, depression, self-esteem, your self-image, stamina, flexibility, and fatigue. And you can tell by looking at me that exercise is a challenge for some of us. But there are many ways that we can exercise, and what we're really looking at in dealing with these issues, the psychological issues and physical activities, is exercise of the thigh muscle. So we're looking at biking, swimming, or walking. And the recommendation would be 20 minutes 3 times a week. So 20 minutes a day, 3 times a week. Now, Dr. Rutledge is a little bit more rigid on his standards for exercising. He's recommending 30 minutes a day, 6 or 7 times a week. So to me, that's a bit of a challenge, but he's in great physical shape, and he's a doctor, and his research comes from more of the medical profession. So that's his recommendation for physical activity. So activity can be really anything that keeps you moving and keeps your muscles and your joints and everything flexible, but most of all, what makes you happy and what makes you feel that you have a quality of life. So we want to deal with emotions, and why are we dealing with emotions in the cancer patient? Well, we know that a common psychological response is shock and denial. No, I can't have cancer. There must be a mistake. The slides got mixed up. The biopsy must be wrong. Did you double check it? No, I don't understand why I have cancer. I've always been healthy. I don't drink. I don't smoke. I hear all of those things in my office, and there's a real sense of betrayal and a real sense of how did this happen to me that cancer patients will first go through. And that's a time of real uncertainty and a real anxiety-provoking time when you don't have a lot of information and decisions are still being made about treatment. You may not have met your team, your medical team yet, so you're just really in a lot of uncertainty and a lot of shock and denial. And that can lead to a lot of turmoil, a lot of upheaval and a lot of change in the family, particularly if you're having to go to a lot of appointments and doing a lot of the staging, a lot of the testing, and having a lot of appointments and follow-up to that. But over time, people do adapt. And what helps people adapt? There's several different things, and the research from 2009 showed that there were 3 really important things that helped people adapt. The resources that you had inside yourself, your sense of resilience, your own strength, and how you were able to survive change and what things you'd already gone through in your life. Then secondly, and I often think that this is really just important, so these are not really in order, but just 3 things. The interpersonal, your family and friends, that we have so much research that tells us family and friends are what helps people through a cancer diagnosis. And it can be the family that's close to you, or many people say it's the new family that you develop as you go through your cancer journey. That there will be people that fade away from your life, and there will be people that come into your life and step forward and who are there for you during this difficult time. And thirdly, and this is what Mike was talking about, the social, economic, or financial resources, whether it means your income to keep you in your house and keep bread on your table, or whether it's the drug coverage that you might need, whether you can afford parking. So all of these things help you adapt to what you need to go through with your cancer. Now, I would be remiss if I didn't talk just momentarily about depression. We know that 1 in 4 cancer patients can become depressed, and we know that it's a combination of the physical trials that people go through, and we also know it can be from the emotional stress that people have. But there's a difference between the sadness that people deal with in a diagnosis and actual clinical depression that needs to be treated by a medical professional. So first of all, with sadness, it can last for short periods of time, and the inner strength kicks in. The resilience that I just talked about starts to kick in, and you're motivated to get better. So you might feel really sad and discouraged and have a real pity party day. Everyone needs to have a good pity party. And then you start to feel better because you just, you're sick and tired of staying in your pajamas and under the quilts, and you just decide that it's time to get better. And it's not extreme. It's kind of a dip. However, depression is an extreme depth of feeling. People who are depressed have a dark cloud over their head, and it does not last over time, but it gets worse. And it deepens. People are unable to function. They can be unable to eat or sleep, and their body, it's just almost shutting down on them, and it does need to be treated or at least minimally assessed by a medical profession. So I do want to put that out to people that they need to be cautious about sadness versus depression. And depression, really, the key is if you feel a loss of pleasure or interest in your life for longer than 14 days, please seek medical treatment. One of the things that really comes to mind when we start talking about cancer, and this is more so in the later stages of cancer, people diagnosed with stages of 3 and 4, where they feel a survivor loneliness, where they really start to become aware that they have an aloneness, and they're very alone in their awareness of their mortality. And they may recognize that we all walk on this earth alone, and although we have our family and friends with us, there's also a part of us that really deals with our own mortality at a very deep and alone level. And some people will really start to feel this during their cancer journey. They recognize that ongoing symptoms may not be recognized. They also can feel very differently about themselves emotionally, and they can feel differently about their body. And some people may feel that their relationships are much more fragile than they used to be. And if you're dealing with cancer over long periods of time, or the gentleman that Dr. Kapoor talked about, for 8 years, the stress that can cause for your family and friends can be quite difficult, and the relationships become fragile, but they also become much more valuable. And some people are more vulnerable to survivor loneliness than other people. And we can't not think about walking through the doors of a cancer center without a cancer patient thinking about fear of recurrence. And fear of recurrence is really just becoming aware of the fragility of life. All of our lives are fragile, but once you've been diagnosed with cancer, you recognize just how fragile life can really be. And for those who have led somewhat of a carefree life and haven't really been touched by cancer or other tragedies, then they just may not be aware that really life is a fragile and delicate thing. A cancer patient really may struggle with that. Not all cancer patients do, but some certainly do. And Musa Meyer is a writer who has had cancer and has had recurrence of cancer herself, and she talks about this as a crisis of belief, that sometimes your whole belief system or your whole understanding of the world gets shifted a little bit. The threat of recurrence means that you're living life with uncertainty, and that can be stressful until you sort of learn to adapt to that. And again, it's a matter of adapting to it. And that people worry about the threat of death, and sometimes the imagination of death or the fear of death can be much worse than the actual reality. And many people will miss, when they're talking about recurrence, that there are actually drugs and treatments and many things that could be ahead of them, that they really need to consult with their doctors about that. So once again, we go back to what is it that you need to know if you're worried about a fear of recurrence? What do you need to know from someone like Dr. Kapoor or a trials nurse about what may be ahead for you? Eleanor Roosevelt said, you gain strength and courage, confidence by every experience in which you really stop to look fear in the face. So when we stop to look fear in the face, sometimes that means dealing with our emotions and dealing with stress. And there's lots of ways of doing that. And certainly one of the ways of doing that is by seeking counseling by someone like a social worker, psychologist, nurse, psychiatrist, your family doctor, by journaling. People need to grieve. They need to recognize that there is a change in their life as a result of cancer, by accepting that change. By telling your cancer story, whatever that story might be. Mike has told his story, and everyone in this room has a story about cancer to tell. Praying, support groups, attending resources. I think there was a resource list that has been provided along with this. So there are support groups that are available. There is online counseling, peer support. There are all kinds of ways that you can deal with your emotions. And meditation is one of them. And Dr. Rutledge talked about meditation. We actually practice some meditations. Meditation can be as easy as counting your breaths. Try sitting quietly and counting 10 breaths. I dare you. I dare you to do that. So once you've tried that, keep trying it, just thinking about it. Just think about your breath and your breathing, and it's quite a challenge, but it really forces you to think about just your breath. And if you try that and you don't have other thoughts coming into your head, then you're a very unusual human being, and what your goal is to focus on your breath, and that does help reduce your stress level. Okay? There's lots of ways of being social. Being social helps you have fun. It causes you a distraction. It gives you support. And my favorite way of being social is with family and friends. Sometimes it causes such a distraction I'm really irritated, but overall I wouldn't give it up, and I certainly would enjoy walking my dog, and he thinks that's pretty social. Okay, so cancer can bring changes in relationship. And somehow I've missed there we go. One of the problems is that the patient focuses on healing, whereas the patient family member may really want the patient to move on. And once the treatment is over, the patient is still focused on healing, but the caregiver really wants to move on and doesn't always understand what the cancer patient is going through. That's not always the case. We have many, many cases where the caregivers are very caring and really do have empathy for the patient. But just to be aware that there are lots of reasons why changes can occur. I'm just a bit aware of the time, so I'm going to kind of hurry through this. So the most important thing is to recognize that there is a problem and talk with the person that you're having difficulty with about your concerns. It's always important at different times in your cancer journey to take a holiday or plan a ritual to mark transitional times. And transitional times for many patients are when they're well from surgery or when they've completed their chemotherapy. And I have patients who burn their chemotherapy pans as part of their ritual for chemo. And it's actually quite amazing the number of patients who actually use fire as a way of having a ritual. Don't make any radical changes for about a year, and then just be aware of the changes that have happened in you and other people. I was asked to talk briefly about talking with children. So there are 3 C's that children are concerned about. First of all, children may feel that they did something to cause the cancer. They may feel that it's contagious, and they will worry about who will care for them. So if mommy or daddy is at the cancer center, they'll be worried about who's going to help them with homework, who's going to get them their dinner, who's going to tuck them in. Some older children may worry about if mommy or daddy or grandpa or grandma, whoever, is going to die, and then who's going to care for them. And children need to be talked with honestly and carefully about these questions. They need to be told the truth, but you really need to temper the truth with the age of the child. So you want to be very aware of the age of the child. Certainly you're not going to tell a 4-year-old the same thing that you're going to tell a 13-year-old. And there is information available through the Canadian Cancer Society on how to talk with your children. It's a book that it has been written by an oncology nurse. It's been around probably 10 to 15 years, but there's nothing better on the market. And the Cancer Society and the cancer centers have permission to copy it. So we get you get a copy of it, and it's been copyright approved. So the Cancer Center does have a very good resource center, and we have a supportive care program. So some things to consider for the future, and these are things that all of us need to be aware of. We all need a power of attorney. There are 2 kinds of power of attorney. One's for personal care and one is for finances. You can have more than one person on your power of attorney. Again, we all need it because who knows what's going to happen to us tomorrow or later tonight or down the road. We all need to have a will because that is good financial planning. The will tells what's going to happen to our belongings and to our things, our car, our house, our mortgage, after we pass away. And as good citizens of the world, we all need to have a will. Just for all of us, focusing memories on the positive is a very important thing to be doing. We all need to increase our verbal and physical affection for each other. We all need to give each other more hugs and kisses and I love yous. We all need to be aware of how our words impact on each other. And you also need to keep records of your appointments and your treatments so that you know what's happened to you and that you can act as an advocate to yourself so that you have a record and you can know what treatment has been effective, what treatment has not been effective, when you had it, and what sort of has worked for you and what hasn't worked for you. So there are lots of resources available to people. The Canadian Cancer Society, I can't say enough about them. They have resources everywhere, and they're certainly available through websites, Kidney Cancer Canada, and certainly your medical team. I was asked to speak very quickly about financial resources. Just in order of the way we look at it, first you access your short-term benefits, you look at your long-term sick benefits, you can access your registered investments, but you do need to talk to your financial planner about that, and you need to investigate disability waivers on any of your car loans, credit cards, bank accounts, line of credit. Sometimes you're paying for those disability waivers and you're not even aware of it, and it's in the small print. You're paying a little bit extra charge. The reason you're not aware of it is because many people don't use it, but it's a great way for the financial institutions to make money, and my financial advisor told me that. Be aware of tax credits that are available to you. You can find that out on Services Canada website. Also on Services Canada website is the Employment Insurance 6 benefits, which is 15 weeks. You need to have paid into that through your employer to be eligible. Ontario Works is for you when nothing else has, when everything else has been a no. It's not very much money. It's only $500 a month approximately per person in your family or less, but it does cover most of your drug coverages. We only advise it when nothing else is available to people. Ontario Disability is available to people who do not have sick benefits. It does take 4 to 6 weeks, but it is for people who are disabled for a long period of time. And Canada Pension is for people who have paid in through their employer. You need to have paid in within the last 6 to 9 years. It's your money. and you can access it from Canada Pension, but the criteria is fairly strict, and you can access that on Services Canada as well. So coping is about adapting and resilience.
Thank you very much, Linda. A great presentation full of lots of tips that we can all take home with us on how to cope with a cancer diagnosis.